This is Dr. Tawari.
And this is Dr. Kochak.
And you're listening to the
Best podcast ever.
Broadcasting from Columbus, Ohio, we'll be talking about plastic surgery procedures focusing on only the breast.
Ranging from breast reconstruction to breast enhancement and reduction, we'll cover everything you ever wanted to know about the breast. Well, welcome to the Breast Podcast Ever. I'm Dr. Kochak.
Dr. Tawari, how's everybody doing?
We're really glad you joined us again. We've got yet again another amazing guest who's going to be chatting with us today about breast implant-associated illness.
Yeah, we're very fortunate this morning on a very early Sunday morning. Fall back with your clocks, everybody. We've got Kristina Slemker here, who is a patient of ours who's had quite a journey with breast implant illness and was gracious enough to spend some time talking to us. So, Kristina, good morning. How are you doing?
Good morning. I'm doing really good. Thank you for having me.
Well, it's our pleasure, and I'm really kind of excited to talk to you because we've obviously talked quite a bit, but we've never talked in this way. And so I figured we'd just get right into it and kind of talk about what brought you to what led our paths to cross.
So it was a long time coming. It was a 6-year journey for me, which was interesting because when I met you, you told me that you had been studying this for 6 years. So I feel like when I got them is when you probably started getting into it. But yeah, so I was a fitness competitor. So at like the peak of my fitness. And of course I was like, oh, let me make an enhancement here. And just kind of got them done, just to look better on stage, I guess. But within 2 weeks of having them, that's when everything changed for me. It was that quick. So they definitely triggered something. The first thing that I noticed was I gained weight. So I, like I said, I was a fitness competitor. I knew everything I was eating, my workouts, everything was, on point. And all of a sudden I was 10 pounds heavier 2 weeks after having them put in. And I know the breast implants didn't weigh 10 pounds, right? So that was the first sign for me. And then just being so overly fatigued around 9, 10 o'clock in the morning. That was crazy because I was working out, twice a day. I had great energy, obviously not post-surgery, but, I just knew myself. I was very in tune with my body. And at that point, I let it go for about 3 months post-surgery. Didn't even think or consider that it would be from the implants. I just didn't. And I went to my women's health doctor and I told him, I was like, I know my body, I've gained this weight and I can't lose it. That was the other thing is I was at that point, 3 months post, I was working out consistently again and it was not budging. And I had kind of been researching a little bit on my own, like what could be doing this? And I told him, I was like, I think my thyroid's messed up a little bit. And he was like, okay, we can run the numbers. He was kind of against it. He was like, I don't think it's that, but I'll run the numbers for you. So he did, and he called me the next day and he was like, yeah, your thyroid is elevated. You're hypo right now. And he just right off the bat was like, I'm going to start prescribing you Synthroid. So I was like, okay, I trust him. I guess if that's going to help me, then let me start taking that. Did the Synthroid, took about 6 months for my numbers to level off, but I still didn't feel right. So medically, it looked good. My numbers were good, but I know I wasn't feeling right. I was still super fatigued all the time, didn't lose any weight. But, at that point, it's just like, I guess I'm just going to continue on and we'll see what happens. So the next thing that happened was I developed this horrible cystic acne. I was 28 years old and never had any skin conditions my entire life. And then all of a sudden, painful cystic acne. And I went to the derm and he was like, yeah, your hormones are out of whack. And that's why this is happening, obviously.
The people can't see you on the podcast, but just so you all know, her skin is flawless.
Oh, yeah.
No, we're gonna have video now too. So remember, we're gonna have our little YouTube segment, so it'll be up there. So
yeah, so yeah, I never had skin issues, so that was just crazy to me. But my derm was like, we can do Accutane. So I did do Accutane, and I actually had to do 2 rounds of Accutane, and it did clear it up. So took care of that. So I feel like I was just kind of going through, and every time something would come up, then I would have it taken care of. So the next thing that happened after that was my cycle was all messed up, all over the place. You know, I was menstruating for like 30 days at a time. It was insane. So then I had to get that taken care of, and I went to back to my women's doctor for that.
Kristina, all this stuff happened in the absence of any other changes. It was the only thing that changed was.
It's the only thing. And looking back, hindsight is 2020. I'm like, why did I not think that? Why did I not put it together that it was from that? I just didn't. And everything I'm saying was over the course of, this was probably the first 2 years. So the next thing that I had happen was just this constant bloat. And I know people had talked about the brain fog, and that was just kind of happening for me. So my doctor suggested I do a food sensitivity test. So I did that, not because I never had any reactions to foods that I was eating, but I was like, okay, well, let's see what happens. It came back like 32 foods that I was sensitive to, and they were all the foods that I was eating when I got my breast implants, which is weird. It was, my competition diet. So chicken, asparagus, almonds, whey protein, things that you don't hear people having sensitivities to. But it was basically my diet, everything that I was eating consistently. So that was really hard. I had to take 12 weeks and, cut all of that out. And that did help when I cut those foods out. But at the same time, I'm like, why am I all of a sudden, at this point, I'm like 29 years old and I have food sensitivities to foods I've been eating my entire life. So,
At what point did, I assume at some point you had to fall out of this competitive bodybuilding thing.
I wasn't able to compete anymore when I could not.
So you got the implants because of probably the pressure to be able to compete, and then really honestly, you couldn't keep going, it sounds like.
No, I knew I could not keep going because I was supposed to step on stage again 3 months after my surgery. But 3 months after my surgery, I had no idea what was going on with me, and I couldn't lose weight. And, I hate to say it now, but I was so desperate at one point. I took my calories down to 1,000 calories a day just to see, and it still wasn't coming off. That's how I knew something was so wrong, that I was basically starving myself, working out, and nothing was happening, which was, that was very unhealthy. I did not last that long doing that. But, fast forward. So let's say it was probably 4 years after I got the implants. So dealing with all those things, I got married, and me and my husband, we wanted to start our family. So 9 months into trying, went back to my women's health doctor, did some lab work, and I was not ovulating. My hormones were just, crazy. My progesterone was super, super low. So they suggested that I do Clomid. So I did Clomid for 3 rounds, and I did get pregnant successfully. So, and it was then that I was pregnant. That's the first time that I heard about breast implant illness. And the second that I even just heard the term, I know that sounds crazy, but I'm like, ding, ding, ding. It just went off in my head, and I started researching it, and I was, I somehow landed upon, Nicole's, I forget the name of it now, but I know you guys know what I'm talking about, Nicole's Healing, the group on Facebook. And when I joined the group, there was 80-something thousand women on there. So I'm like, okay, I'm not the only one. And I was going through everybody else's, comments to see that, a lot of people did have the same symptoms as me. A lot of people had different symptoms that I hadn't experienced. There was just a wide range of symptoms on there, which I know you know. But so in my mind, I just felt like, once I had my baby and, nursed him for as long as I could, I wanted them out. And that's how I found you guys. So.
Yeah, you just walked right across the hall.
I know, yeah. Yeah, that was really funny because I didn't, I've walked past your door so many times, never even looked at the sign. I apologize. And then once I kept seeing your names in that group and I looked you up, I'm like, wait a second, there's no way you guys are across the hall from me.
I mean, there's so many things in your story that I think I hear so often among patients. And I think, yes, people have a lot of variety of symptoms, but there are common themes that I think we hear frequently. You know, I think the thyroid issue comes up frequently. I think that brain fog, cognitive issues come up frequently. I think fatigue is a big one. And then this kind of bloating, weight gain, those issues come up a lot. And I think what makes this breast implant illness topic so difficult is they are such non-specific symptoms, yet you hear them so commonly among patients. It's hard to imagine there isn't something relating them. And we did a nice podcast, I think it was last week, with Dr. Choksi, who's an integrative medicine doctor, and he made some really, really interesting points that can kind of help us understand how a lot of these things can even be connected. So for us, we've been trying to figure out, you know, what is this underlying thread? And you kind of painted what I'm sure was a very, very difficult 4 years together into how you came to your decision. But I want to explore with you something I've always been really curious about. Why do you think women have a hard time correlating the implant placement with these changes to their health?
So 100%, I just never correlated it because so many people get them done and I had never heard about these issues. So that's one of the biggest things of why I'm so open about what happened to me, is because I just wish I had this, you know, this education that this is a possibility. You know, this doesn't happen to everybody. We know that. I think it's what, 10% of women. But even just having the education to better make my decision about it. Because like you said, I just didn't think that it was from that, just because so many people get implants. I'm like, oh yeah, it's like, you know, everybody gets them pretty much. But yeah, as soon as I heard it, that's when it struck for me that that's what it was.
Yeah, for me, part of it is, you know, we make the implant operation, oh, it's just implants. You know, it's not, but it's still a real surgery. I mean, there's a real recovery, there's real issues with implant placement. But I think the narrative around it is painted that, oh, you know, it's going to be a short recovery and you'll get these implants and everything will be great. I don't think people really even register it. You know, oftentimes when you ask patients what surgeries they've had, they leave out breast implantation, breast augmentation. You know, it's almost like we don't even consider it a surgery. They'll talk about, you know, their thyroid, they'll talk about maybe their appendix being taken out, but no one ever says, oh yeah, I had a breast implant surgery. I don't know if you have.
It's pretty fascinating. I find is that from now seeing so many patients with this sort of situation, the timing, like you said, you notice things pretty much right away within weeks of having implants. But some people go a period of time, and then suddenly after a long period of time, they start to have things develop. I find that very interesting, and it just kind of goes along with what Dr. Tawari is saying. You know, it's hard to understand how some of these non-specific things, not just how they're how they're connected, but also what prompts them to start or not start, right? It's very curious to me.
Yeah, I think that if I wasn't so in tune with my body, I probably hadn't, I wouldn't have noticed as soon as I did. But just the circumstances of what I was doing at the time of my life is, you know, why I started to notice right away.
And it's funny, we do see a number of, fitness competitors who've had implants placed, probably for similar reasons that you explained. And I do feel that those patients tend to present earlier than our average patient. I think probably because they're so in tune with their bodies. You know, actually the last patient I just operated on was a fitness person, and she was about the same time course. I think she had them for about 3 or 4 years before she noticed these changes. So I do think that there's an element there that people that are very, very in touch with their nutrition and their weight profile notice these changes almost right away.
It's so true in your world, and when you're in that world. I mean, I had a lot of friends and colleagues who were in that stuff, and I became very curious myself. And it's fascinating. I mean, you guys have like a dial, and you're able to really control every little thing, and it's with great discipline, probably the most disciplined thing I've ever seen anyone ever do is cutting for a competition. It's actually fascinating. But I think just being so in tune with your body definitely would make you present earlier because you're so aware. I mean, the only time I know something's changing is when my scrub size has to change. And let's be honest, there's about 8 pant sizes in there before you notice something. It's not a good.
Very forgiving. And I've learned so are joggers. Joggers are very forgiving. They're like our fancy scrubs. Anyway, okay, so let's fast forward to the decision process. So now you've understood that there may be a link here that may be explaining part of what's been going on over the last 4 to 6 years. But still, that emotional decision to commit to a surgery, to remove these implants. Walk us through that. What you experienced.
So for me, just because of everything that I had gone through, that part of it was actually not that hard. I wanted them out. I really, really wanted them out. I didn't want to wait to see what the next thing was going to be that happened. Even if, let's say it wasn't related to it at all, I really didn't want to take the chance, and I was done with them. I wanted them out. I never competed again after that. So, I just, that was actually the easiest part for me, was making the decision to get them removed. It was just a tricky time in my life because, like I said, when I learned about it, I was pregnant and I knew I wanted to nurse my son. So it was just finding the right time to do it. And then obviously trying to get in with you guys. So, but yeah, no, I knew I wanted them out.
I will say, obviously it's not an easy decision for everybody, and that's okay. Everybody comes at this from a different mind frame, but there are many patients, like you, who have made the decision in their mind because they just want to feel better. For other patients, it's less certain, and that's okay. We talk through that. But for someone who knows herself as well as you do, I think I can see why it was an easier decision. How was the surgery? Was that worse than you imagined? Was it less than you imagined? Take us through that.
So my recovery after having the augmentation was not bad. I was good within 3 days, so I was kind of expecting it to maybe be a little similar, but it definitely wasn't. It was harder than I, thought that it was going to be. The drains were very, very hard for me. I wish I'm sorry.
Nobody likes drains.
No, nobody likes drains. And then just kind of, going back to that, I was ready and I wanted them out. I guess I never really allowed myself to think about how they might look after. So that was kind of hard for me. I'm not going to lie. The first 5 days post-surgery, mentally seeing myself like that was very, very difficult. But it was because of the drains. I wish that somebody would have kind of told me like, hey, just so you know, when you first see yourself with the drains in, they're not going to look how they look when the drains are removed.
That's a really good point. That's a really good
I did not know that. And I was going through that group on Facebook, like, please tell me somebody that this is going to look different, and I couldn't find anything. So that was one of the things I posted about so other people would know, because
I think for our listeners, it's important to explain here that the drains actually place suction on the tissue. And so it keeps the tissue kind of in a different shape than the tissue will take after that suction is released and the drain is gone. So that's a really good point. Not something I've ever really thought about, but you're so correct.
It's never come up, to be honest. But it's something that we should start talking to patients about, because that's exactly, well, just like Dr. Kocak said, there's suction there to make sure there's not a fluid collection, to make sure there's no, chance for a
So not only does the drain, not only are they a little uncomfortable, maybe a lot uncomfortable, but they're also going to cause your breasts to look different until they're gone, and things will change after the drain is out. Wow,
yeah.
You just changed how I'm going to counsel every patient.
Yeah. It's a great point.
So that just those first 5 days, looking different, seeing myself look like that, which I didn't even think was going to be, a big deal for me, because I wanted them out so bad. And then just the discomfort of it. And then another thing for me, not being able to pick up my son. So those were the hardest parts for me and during the recovery process and the surgery in general.
Talk to us about recovery.
So as soon as the drains came out, I felt like a different person. I was so happy just, with the way that they looked and feeling better. Obviously, feel like you can move a little bit better, but my baby was 11 months at that time, and I know I still wasn't going to be able to pick him up or anything. So that part was hard for me. I just had to make sure that I had, help. When I was home, I had to make sure somebody was going to be there, that they could help me, take the baby out of the crib, put the baby back in the crib. But other than, the aspects with my child, recovery was just, the same as I feel like any other surgical recovery. You're pretty tired at first, just trying to get your strength back, your body just trying to recover from major surgery. And then just the limitations you have with your upper body at that point.
Yeah.
Did you notice, how far out are you now? I don't think I know that exactly.
I was a year in August.
Okay. So a year's a real amount of time. So I've got a couple really curious points here, especially having been in the fitness world and you were bodybuilding and obviously are probably very aware of your strength. When the implants went in, were they under your muscle or on top of your muscle?
Under my muscle.
So did that change your physical, ability to lift and move? Did you have discomfort associated with that?
Yes, I could feel them obviously every time I did any type of workout, that focused on the pecs. I could feel them moving back and forth, and I could see them moving back and forth too.
Did you get weaker?
That's a good question. I don't think I can necessarily say that I got weaker. I don't think that I got weaker, no.
And I guess the natural question here is, now that they've been out for a year, can you talk a little bit about how that feels in terms of the mechanical, sort of the pain piece? I'm always really curious because you're going to know very well, being so active.
So I probably should have said this first, but I was pregnant for most of that year. So I just had another
you weren't
baby
bench pressing with baby?
Yeah, I worked out my entire pregnancy,
Nice.
doing push-ups and everything up until my due date. But yeah, no, I actually am just going to get back into working out starting tomorrow because my baby is 4 months today. So I'm sorry, I can't really touch too much on that because I'm not there yet. But I do want to add this to it. So for the 3 months, Dr. Torrey, I know I asked you, I'm like, how soon can I start trying for another baby again? I remember you told me, I had to wait a month. But I had been getting my blood work checked for 3 months before the surgery to see, if I was going to need Clomid again. And I was not ovulating for 3 months before the surgery, no ovulation whatsoever. Had the surgery, didn't even think, it wasn't even on my plate that month because that wasn't going to happen. The very next month, I got pregnant. So, I don't know what the correlation is. It's just, to me, I feel like it was from the implants. How could I not be ovulating for that amount of time? And then a month after, it was easy. I didn't need any drugs or anything. I just got pregnant on my own. So.
Again, you hear these stories and it's hard to draw a line between 2 points sometimes, but some of this anecdotal evidence is so compelling that it almost creates more questions than it answers.
Yeah.
But what about in terms of your activities of daily living, holding your baby? How's your comfort level when you're using your shoulder girdle, your pec muscles now versus before?
You know what? I have a lot more. My range of motion has improved dramatically.
Mm-hmm.
And just from a mechanical standpoint, when you have, heavy implants on you, your posture kind of starts to round. So I had a lot of that going on, and that has improved significantly. And yeah, just being able to, pick my baby up and just everything with my range of motion has improved significantly.
I'm curious about something. It's kind of a tough question. I'm not even quite sure how to ask it. So, femininity and being a woman is very culturally driven. And, Western culture has a certain ideal for women. And we all know what those ideals are, large breasts, maybe larger buttock areas coming into a cultural fashion, let's say. A lot of, I think, the fallback or the controversy around breast implant illness, I think has to do with, it's almost like in confrontation with cultural norms. So I guess my question for you is, as a woman, how has this decision impacted your femininity, your concept of yourself, how you see yourself?
So I know this probably isn't going to be the stereotypical response. I am much happier and I feel much more myself without the implants. I got to the point where I was resenting them because of everything that had happened. And when I thought that they were correlated with everything that was happening to me, I resented them. And I just wanted smaller breasts. I did. I just wanted them to be smaller. I wanted to be natural. And, that was the question that a lot of other women asked me the most once they found out that I was going to have the surgery is, well, what about what you're going to look like? Like, number one thing, how was I going to look? Not, how am I going to feel? How's my health going to improve? But what do I think that I'm going to look like? And basically, how am I going to feel about how I'm going to look? And I think that if you have no problems from the implants, then yeah, you're like, well, why would I, downgrade? But when you do have the issues from them, and like I said, resent them, everything to me seemed better without them. The way that I was going to look seemed better. The way I was going to feel seemed better. So it's not, I know that's probably not the stereotypical response for women in our culture having their breasts downgraded, but yeah, that's how I felt about it.
But I think that's important to hear because it's very significant to have other women hear that who I'm sure feel the same way. And it's, I think, a difficult thing for people to communicate because it does kind of, fly in the face of what we see in the media and what we see, in just popular culture. So thanks for taking us through that, because I think it's a difficult thing for me as a man to wrap your head around sometimes.
Yeah. I mean, and I'm not sure if you guys know that I am a nurse injector. I'm an RN too as well. So I do work in aesthetics. So, I see a lot of wanting to enhance our physical features and all of those things. But this whole process has just made me a little bit more into the natural beauty that we have, as women. So, yeah. Another thing I wanted to add, sorry, before, I don't want to cut you off, but one of the first things I noticed too, after I had them removed, is those first 2 weeks, I lost 7 pounds. And to me, I feel like that was inflammation that I had been holding on to, and it was gone.
Yeah. And I think that, again, that's not uncommon. Doesn't happen to everybody. But I've heard from multiple patients that they've had a weight loss post-operatively in the 7 to 10 to 15 pound range after having a lot of difficulty losing weight prior to implant removal. Again, it's hard to line up those dots. Maybe it's inflammation, maybe it's something else, who knows? We haven't really done the science to understand why this happens, but the anecdotal evidence is compelling, and it, again, brings up more questions than it answers.
Yeah. And just because I did get pregnant so soon after the removal, I haven't really gotten to delve into, any other symptoms that have possibly lifted, because I felt all of the, pregnancy things that you feel. But I will say I am going to have, my food sensitivities tested in the next month. So I am very curious to see if any of those have changed, and then just kind of see how my body responds, postpartum now too, without them.
I think on the inflammation side, we always like to try to comment a little. We've been working on that piece, trying to understand it more, and at least we from the beginning have always been sending the capsules off for microbiology and pathology. You probably know that you had yours sent off, and it's interesting because we didn't expect to see as much of what we're finding. We're seeing that I think it's over a third of the time, isn't that right, Pankaj?
Yeah.
There's a chronic sort of indolent infection that is in the capsule. And that's very curious, because we think that it's possible if a person is trying to fight this bacteria that shouldn't be there chronically for a long period of time, it's quite possible that some of these things that are more, vague, difficult to understand connections might be actually make a lot of sense in that setting.
Yeah, again, we don't have direct evidence, but to have almost a third of our patients have a low-grade bacterial, sometimes fungal contaminant, sometimes multiple organisms, multiple bacteria, it's hard to imagine that there isn't some consequence to that. Maybe there isn't, we don't know, but it's hard to imagine that there isn't some kind of impact that makes people that are generally healthy, generally feeling well, not feel quite as well, particularly people that are in tune with their body, understand their diet, understand their exercise regimen. Kristina, what are some things, you've already given us a major one, which is the drain piece, but what are some things that we as plastic surgeons should be aware of when we're talking to breast implant illness patients in general? I mean, you have your own patients, so you understand the dynamics between providers and patients. So what advice can you give us?
So one of the big things, like I said, I'm in the aesthetic world as well. So I always want to let people know what they can expect in terms of how they look, and realistic expectations. And I feel like another thing that I see a lot in that group, but was never really discussed with us, is the possibility of those like the indentations. I'm not sure if that's the best way to describe what it is, but definitely that. And then just like, I don't think I have that, but I do have something that I've actually been meaning to come back in to have you take a look at. It's like an extra crease that I have in my, So basically just things like that. And then, that they will fluff back up. I think that's the best way to say it, in terms of the appearance of them. And, really just to give yourself a solid 6 months to a year before you're like, okay, this is how they're going to look in terms of the appearance, because they just keep getting better and better as time goes on. And I don't really think that was discussed too much, prior to surgery.
Yeah, I think fluffing is a great one, because, I'll get asked that question all the time. What is fluffing? Can you turn fluffing into medical terminology? And so when I explain the process of fluffing, all it really is wound healing. Whenever we have a wound, whenever you have a scar, your scar contracts. So when a scar contracts, what does that mean? Well, it sort of reduces the amount of surface area. So the tissue is less saggy, more perky. There's also intrinsic recoil to your skin. And the better your intrinsic recoil, the more you'll quote unquote fluff. For people that have very, let's say, poor skin quality, you've got, for example, stretch marks on your skin. Those are people that won't fluff as well, and they will need a lift. So, I think fluffing is confusing because it's not a medical term, but I think they're sort of principles.
It also describes the opposite of what's happening, because technically it's not filling with volume. Technically, it's the container is getting a little bit smaller slowly over time. So it looks like it's fuller.
Right. It's the same volume in a smaller container. I think that's a great way to put it. But it's based on real, biological changes, just like any scar. It takes about 6 months to a year for that scar to mature. And I think that really explains kind of what you experienced. I think that second fold is something that we do see a fair amount, and that's a tough one. And it's, the fold is a real sort of anatomic area, just like the creases in your palm, for example. And sometimes the implants undermine that fold, and it's hard to reestablish that. So I'll be honest, I don't have a great solution for it. We've been resetting the fold a little bit more aggressively, and I think that may help it. So that's something we can certainly talk about offline, but I do think that is, that's one of these problems that we see with this surgery. And at some level, we're kind of like pioneering and figuring this out, because it's never really been addressed in a formal educational setting, as far as I know of. And it's certainly not something that we were never trained on in our training. So, Dr. Kocak and I spent a lot of time just, hey, what should we do here? And what do you think about this? And sort of figuring it out on our own.
We have our own mini symposiums pretty much every other week where we kind of address, hey, this, what could we have done differently? What should we do about this case? More complicated cases. And like you said, I think this is definitely an area of plastic surgery that's in evolution. It has popped up at just a couple meetings before the COVID stuff started. It did surface a little bit, at least in terms of people talking about technique. The bigger topic has been, what's going on with this? Why is it happening? Why are people, but as far as surgical techniques, I think there are a few more people trying to talk about it now. And I think as time passes and we do more and more of these cases, I think we're learning a lot. And I think we're very quick to implement changes in order to kind of prevent things that are happening more often. I think even our practice over the last few years has evolved tremendously. I think we've really managed, I think the results are just getting better and better. So I think this is going to keep growing and going in a very positive direction.
Yeah, it's interesting what you said about, wanting to feel more natural. That's another thing that we hear more and more. I think we always saw that in our breast cancer patients, because we do a lot of, what's known as deep flap or autologous reconstruction, avoiding implants. And that sort of naturally brought us to the explant patients. But I think this move to a more natural outcome is...
Have you noticed it in your own practice though? I mean, you're an esthetician. You've got to be seeing this. It's got to be evident to you too.
Well, 100%, whatever I do fillers and, Botox, that sort of thing. But 100%, the first thing they say is, I don't want to look like I have anything done. I've never had a patient sit down and say, pump me up, make me look like I've been doing this, No, they want to look very natural. They want to age naturally.
Which I'll say is different. I think when fillers first came out, I don't know if, Ergen, you had this experience, when I first started.
No, yeah, I know exactly where you're going. There was the opposite. It's like, make it look like I had something.
10 years
oh,
ago.
okay, yeah, no, in the time that I've been doing it, I have not had that response.
10 years ago, I remember people telling me, I want to look like, I've had something done. I want big lips.
And I want my face frozen. Freeze my face and make my lips big. That's when we about left that whole world. So maybe we could get a little bit of an update from you. But also with the stuff you're using, Kristina, are they more worried about the ingredients of the stuff? Are they leaning towards more natural product lines rather than the more chemically based ones? I feel like you just see the stuff popping up everywhere now.
So I think the people that are worried about the neurotoxins themselves, they don't even come to do it, they won't even come to do it. So no, in terms of, the ingredients or, what the product is made of, I don't have people necessarily as worried about that. As just they want to look more naturally. And it's funny that you say that, make me look like my face is frozen, because that is the number one thing. I don't want to have a frozen face. That's what they're telling me they don't want now. They're like, don't make me look like Jack Nicholson is what they say. So, yeah.
Well, I think this has been yet again, an amazingly educational experience. More for us, I think, Dr. Torrey, don't you think? I feel like we always end
I
up...
learned a ton in the conversation. Thank you, Kristina.
Oh, you're welcome. I'm so excited that I was able to, tell my story again, if I can help anybody. And just to reiterate, I know this doesn't happen to everybody, and I don't want to scare anybody, but just to have that education, I think is super important to make a decision like that.
I think that's such an important thing to say. Like our purpose is not to create fear and anxiety. That's not the purpose of conversations like this. It's to make patients aware that if you're feeling these types of symptoms, it is wise to see your primary care physician, your women's health physician, make sure there aren't other underlying diagnoses going on, autoimmune or otherwise. But if you've had a workup and it's been essentially negative, I think that this is something that patients need to be aware about. And I think you're 100% right that the point of this is education and awareness.
Thanks again for taking the time, Kristina. And we're excited to get this put together and get it out there to the world. So thank you.
Thank you. Thank you so much. And I think it's important to say too, it's so refreshing when I finally sat in your office and had a consultation with you, that somebody believed me, that you had a background in this, and it wasn't just me trying to blame something for everything that had been happening. So thank you so much for that.
Well, Dr. Kochek and I are just curious people, and I think our curiosity leads us places. So this for us was something we were curious about, but I appreciate your saying that. Before you go, where can people find you if they want to see you for natural injections or want to visit with you? Is there any place where they can contact you?
I work at Antares Aesthetic Medicine, but if they want to, contact me about what we've discussed or really anything, they can contact me off my Instagram, which.
And we'll put we'll put the link to that on this, on the description to this podcast today.
Okay, perfect. Yeah.
Thank you
so much, Kristina. Have a great Sunday.
Thank you. Thank you so much. You
Thanks for listening.
We hope you found this episode helpful.
Want more info? Connect with us at mwbreast.com.
And go behind the scenes with us on Instagram at MWBreast. Thanks for tuning in.
And join us next week.